patient's name band. Okay, the patient will not talk to you, so check on the name band, and then you wash your hand. Okay, wash your hand. After you wash your hands, then you prepare yourself with your non-sterile gloves. Okay. If you don't have this liberty of having a sardus bag or this the trash bag, I mean the biohazard bag, then make sure that your biohazard trash is next to you. Okay, it's usually the one that you just step on it. But if you have the luxury, then go ahead and use this. Okay, make sure that you open it. Usually it's a red bag. This is actually a biohazard bag. Okay, put it in there, tape it, and also you need to have your teeth.
You guys look at this, right? Yes. It has the sample of the Darwin chart, right?
Okay. So put it in there.
Yeah. Rationale. Yeah.
In hospital, I'm telling you, you don't have the luxuries of hazardous bag. Okay? So you have your trash bag next to you. Okay? Prepare your patient. Let's say this is your track with the patient. Put it in there next to patient. Okay? Prepare your Trach Care set away from you. So now you actually pour your NSS, okay? Make sure whenever you put it down, not face down.
Yeah. I think the video didn't have it half-half.
No. So in GMAs you usually do it half-half. And policy in GMAs you do a Trach Care shift. Every shift. So you're gonna have a chance. Okay, you pour your secretion. How you pour your secretion? Not on the top, not over, just on the side. Since this is not a new one, we're having there. Okay, you go on the side, and then in GMA it is half-half. Okay, the same thing. You should know by now which is your sterile and non-sterile, or your dominant and non-dominant. Usually your dominant is the one that you can manipulate more. Okay? So now that you have your sterile there, then you actually take out the, okay, we just take out the, usually you take out the gauze in there. So this one doesn't have that gauze. Take out the gauze in there. Okay, put it on the trash. Let's say that's a gauze. Take it. That's a non-sterile gloves. And now you're gonna actually take it out. Hyperoxygenate your patient. Let's say this is on the machine. You press the machine 100%. After 2 minutes, then you can take it out. So make sure you support the plate. Okay. Okay. Sometimes if you don't support it, then that's the problem. Okay, it actually just like this, it takes a resistance. Okay, support in the inner plate too. Okay, support it. Only touch the outer. Counterclockwise, and then pour it on where? Outside. Yes, pour it there. Okay. Okay, so it will. So now that you have. If you have a luxuries, or if you have somebody with you, you can actually tell them to just do these things so it can still oxygenate your patient, because it's going to be really hard. For those that's actually on a tracheostomy collar already, you can leave it like that because they can breathe on their own. Okay, now you take it out. Remember, you can actually touch 1 inch. Okay, touch. minutes for you to make yourself. And then, if it's not, then just go ahead and do this thing first. Make sure you don't touch it. Because once you have your tube, you can actually manipulate it. You're touching the sterile and sterile. Right?
Right.
Tell me if I'm wrong. Don't like, I'm gonna do it. Yeah. Because panic in a little thing.
Sounds like Loida had that experience.
So always,
You're the person who?
I like that guy.
come on guys. Why does it end like that? You can always put a new one or whatever you can do. It's like, don't make it now that you have your gloves fit, okay? So you can actually touch everything, right? Okay. Which one is actually down? The plastic one. This is the plastic one here. The white side.
Can I see the blue? Because the blue is folded inside.
So actually, the blue is down.
Shiny side.
Down there. Okay. You can actually just go ahead and put it down. Okay. You spread everything. Spread it out because see, this one doesn't have the card. Okay. So that means I need to fold. Okay. I'm gonna shout help because that means I need some more NSS. There's no pre-cut. Maybe this is one of those that being used and reused. Okay.
Don't worry, they'll have pre-cut.
So that means let's pretend that there's a pre-cut. But is the pre-cut in there? Okay. So they got everything. So that means that one is actually now you need to. So if you're getting and clean it inside first. Okay, this one you can do it, and then let it soak. Let it soak on the NSS. Yeah.
Shouldn't your thing be on the side because you're
I know.
standing over your
Yeah.
sterile field?
This is the like it's supposed to be on this side, and then after you actually put it on, just tap it a little bit for the excess water. Remember this?
To dry it?
Okay. Use it on just one side of this, or you can put it there. The same thing. Only one, and it's not in and out. Not like you're playing violin. Okay. Then put it. Okay, put it there. Remember, this is your sterile. Put it on your patient. Make sure you lock it. Once you lock it, hey, I have the sterile field done. So now you clean the outer. Okay. Sometimes you will see a crush in there. So now, since I have, you can actually pour some more water. I mean, some more NSS for your other container. What we usually do, sorry, I took out, it's supposed to be. If there's nothing in there, if there's actually something in there that you throw it, what you can do is just on here. Because this, okay? Remember, keep one of your hand always like your dominant, and then you, if there's a lot of crush in there, just wipe it, okay? Okay, wipe it in there. And then throw it there. And then now you're gonna clean your
Inner out.
inner. Okay. From inner, outer, out. Okay. Okay, underneath from inner, out. Because on the, I didn't notice that the tip is outer and in.
No.
From inner, yes, inner
It
and
went
out.
towards.
Okay. One stroke in each side. Okay.
Sure, I gotta watch that again.
And then the other one from inner, out.
Yeah.
Okay. So that's why you need to have like extra, because the thing also is on the top. And then once it's clean, now you're gonna put your gauze. It's gonna be a challenge to put a gauze. So what you do is you put it inside. If you have actually,
Can you unstrap it, like just while you're putting that in for a little
can there's a question. Can you unstrap it?
No.
No. Why?
It might fall
If your patient start to cough, then it might pull out. Okay, so that's it. You just need to try your best and
Well, you can, unless someone's
bit? If you have help,
okay.
then
Once it's there, then you need to change the. Okay. First, you think, is this gonna fit? No. I don't think so. Okay. You don't actually take out this thing just to tie it. You need to tie it first, the new one, before you take out this one. I'm telling you right now, it's not a pre-cut, and this is how you're gonna see it. It's not a pre-cut in the hospital. So you actually need to have your band-aid scissor with you to cut it. And how you cut it is slanting. So you have that certain tip. Okay? So I always go first with my the farthest one. Okay? Sometimes if you have your cotton, your cotton swab, I put inside in there. Okay? This one, make sure always like you don't actually put it underneath. Make it exposed in there. So since this is a shorter one, okay, you tie it on one side. How you tie it? Okay, double. Just double tie it. Okay? And then sir, can you actually pull up your neck a little, up a little bit? If not, you cannot, then ask somebody to help you. Okay, now put it down. Okay.
Patient is unstable.
Then another one, you're gonna see how hard it is. It's gonna be hard when your patient is on a ventilator because your patient is. I wish you could be finished because I'm running out of air. Once you actually have this already, okay, go check. Is it actually one finger?
One finger on the other side.
One finger in there.
One finger is enough.
I found finger on the other side. Okay, so now you tie it, loop a loop, just like when you learn how to tie your shoes. Because you're gonna report to the doctor.
And buy your bandage scissors, because the bandage scissors.
You need to put a new trach because I just accidentally cut it. You're gonna make an incident report for doing that. This one is always need to be intact, so when you cut it away from this one, you cut it in this. Okay, so and then I'll just take it out. And you have a new one. Now, make sure that you actually did everything. Where are you gonna throw this thing? By your side.